Watch these short videos to help you assess different joints of the body using orthopedic tests. This test is called the passive repeated extension test, and it can assess for osteophytes, which are tiny little bony growths within the joint if you fell over and you've got some extra bone growth in there, but also any swelling in the joint as well. So what we do is we take the hand and the arm into lateral rotation here. I'm going to apply pressure up through the elbow joint and down here at the wrist joint. Okay, and we do that a few times, so we're kind of bouncing the joint, so no pain hopefully. Or we're looking for the range of movement as well. So with little bony growths or osteophytes in the joint, you might be in this position where it can't get to 180 degrees. This test is a valgus stress test for the elbow, and for a valgus stress test we're applying force this way from the lateral to medial this way, and we'll be assessing the medial ligament at the elbow joint. So the MCL, medial collateral ligament, or more technically the ulnar collateral ligament. So we're starting off with a straight arm here. I'm applying force through the elbow joint this way and supporting with the hand. Okay, so we're looking for excessive movement or pain at the elbow joint. And we can then repeat the test at 30 degrees of flexion and apply the force again. So we can see some movement there, but no pain would be a negative. This is the Varus stress test for the elbow joint. With a Varus force, we're applying a force this way, medially to laterally through the elbow joint. We start with the arm at 0, and we're going to apply force at the elbow joint line. So support the wrist, and we're pressing with this hand through the elbow joint, okay, which will be stressing the lateral collateral ligaments of the elbow, or also the radial collateral. It's also known as radial collateral ligament here. We can do the same test, but in slight flexion, 30-degree flexion, and you will see more movement, but excessive movement or pain could indicate a lateral elbow ligament sprain. This is an ulnar nerve test, or also called Tinel sign. Now, Tinel sign you can also do at the wrist for carpal tunnel. This one, we're tapping the ulnar nerve here between the olecranon process, or the point of the elbow, and the medial epicondyle. So that space there is known as the ulnar or the cubital tunnel. So that's where we're going to be tapping. So with the client relaxed as possible, and I'm going to use my finger here just to tap around that nerve pathway. A positive for that would be shooting, tingling, or some paresthesia into the ulnar nerve distribution, which is either side of little finger and outside edge of ring finger, and this area of the forearm. And thank you for watching.